Good evening, ladies and gentlemen. My name is Robin Latimore, and I want to say thank you so very much for your contribution to the Robin Latimore Foundation, where we will be recognizing all cancers. Tonight we're focusing on breast cancer and prostate cancer, and we want to bring awareness so that we can prevent any fatalities. I want to thank you so much for your contribution again, and the next party that we have, we hope to see you there.
We have to take charge of what's happening in our community. Early detection is your best defense. When I look at where we are today and from whence we've come, we have come a long ways, but we still have a long ways to do. I pray and look forward to the day that we will have a society that our most precious resources, our women, will not be dying, their lives will not be threatened. I look forward to the day when I do not have to sit and tell a mother, a father, a sister, a brother that their loved one lost their lives because of this disease. And I believe that we as a society, we have the brain power, we have the financial power, and we have the commitment to do a better job than what we're doing today. We need you. We, no matter what we as scientists and doctors, no matter what new discovery we make, it means nothing if you do not take advantage of it. So I challenge you, think about what you can do. What Robin is doing with her foundation is extremely important. As I said, when a woman is diagnosed with breast cancer, every aspect of her life changes. Every aspect, her little world is impacted and impacted negatively by this disease. So what she's doing is important, and what we need to do is support her and her foundation. I know a lot of us, we came in, we didn't pay to get in here. Let's write a check to her foundation. Help kick off this foundation that is so important in helping so many women in our community. So once again,
I am a breast cancer survivor myself. I am also an ovarian cancer survivor. I'm blessed to be here tonight. The breast check kit, I'm just going to piggyback on what Dr. Phillips said. She said it all. She covered everything. But the breast check kit is a garment that shows you how to do a breast self-exam. It takes up away the fear and the anxiety of knowing how to do the exam. I created this shirt actually in honor of my mother and my aunts, who all have breast cancer and are survivors. I've lost many family members and friends, and this started out as just a novel idea, but it turned out to become a passion for me for many years. But the shirt has the embedded diagram that shows you how to do it. You follow the diagram around, and if you feel anything while you have the shirt on, you mark on it with the enclosed marker, so you have something to take back to your physician. This product has been around the world. It has been in existence for about 7 years now. We've been very fortunate to receive 2 patents and a couple of awards for this product. So I hope that you all will take what Dr. Phillips said to heart and to always check yourself, ladies. Please do, because early detection does save lives. It saved mine. It saved many of my friends. So I want to thank you tonight, and whoever is the lucky recipients of these, I hope that you will use them monthly and do your several breast exams and also your annual mammograms. Thank you.
Once again, another young lady that once she knew about my passion just jumped and said, what can I do? These things are expensive, and I know I couldn't afford to get a case of these, but she so graciously donated a case of these.
And the second component, and this is the component that I usually get some pushback on, is something called the digital rectal exam, which is a fancy word for saying the doctor uses his finger, inserts in the man's rectum to feel the prostate, feels for any lumps or bumps or anything suspicious for prostate cancer. Now, of course, this is what a lot of patients don't want to do. A lot of doctors don't like to have to do it either. But certainly, it's something that's very, very important to do. And I'll tell you, a lot of patients will come into my office, it'll be the first time they meet me, they'll shake hands, they'll look down, they'll look at how skinny my fingers are, and then they smile and they say, you're the urologist for me. So when you're looking for a doctor, a lot of times you only see the face, see if you can get a full body shot and see if you can see the side of the fingers as well. So we talked a little bit about PSA. So PSA, as I said, stands for prostate-specific antigen. It doesn't stand for prostate cancer-specific antigen. And the reason why I say that is that an elevated PSA isn't only caused by prostate cancer. And this has been some of the knock against PSA about why it's not as good. But you have to remember, of course, that PSA is not necessarily a diagnostic test for prostate cancer, meaning that if it's high, that definitely means you have prostate cancer. It also is just a screening test, meaning that the higher your PSA is, the higher your risk for prostate cancer. And this is when you and your doctor decide where you should go next. Just to give you some perspective.
In this room, I would hope. It is a personal choice, and every change in every step is a personal choice. Each woman or each individual, male or female, has to make that choice for themselves. I chose the route of treatment for myself. I have not had an aggressive form like Robin mentioned, and I've never had any family history, remember that. So I'm trying to figure out myself, where did it come from? How did it start? And nobody can give me answers to that. So Robin, I respect what you're doing as far as helping us, and I hope that through communication, through education, and foundations like your own, that we can educate ourselves and hopefully find a cure for cancer. Because there's no reason in today's society or in our lives that we should be faced with this at such an alarming rate that we are. So it's very important. If you can't take anything from my story of babbling and trying to get it together since she came to the microphone, take this with you. Self-exams are important. Please check yourselves. If you're not going to stand up and go to the doctor and let the doctor check you, check yourselves. Men, you're going to have to take that little exam that they do when they snap that glove and do the KY jelly. You're going to have to do it. Hey, you're laughing, but it's a serious matter. That simple exam saves lives. And ladies, if you don't want to do your own self-exam, there are kits on the table. If you don't have that kit, your significant other can perform the exam for you. Okay? Exactly. A lot of tears and stuff like that. So, thank you so much, Bob. Thank you so much. And I hope by sharing my personal story and hearing about Regina and the other women and other males and females that are in this room, that you understand that this is a serious struggle, and the struggle is real. And we have to stay alive, and it takes each and every one of you in order to be able to do that. So thank you so much.
Isn't that wonderful? We got a few more minutes to be here.